And thank you for the opportunity to be here as well. So good afternoon, everyone. It's nice to see such a packed room. I'm Pui Lee, as Jeremy has already mentioned, and I'm an infectious disease physician. So my disclaimer is that I'm not a geriatrician. So I'm going to try to speak to you about frailty in persons aging with HIV through the lens of an infectious disease physician. So I'm going to talk about frailty and also teach you how you can measure this in your clinic. So the hope is by the end of this session, most of you should be able to measure frailty. So before I go on, can I ask how many of you have heard about frailty? Can I have a show of hands? All right, so a fair few of you have heard about frailty. How many of you measure frailty in clinic? None? Okay, all right, so I've got my work cut out for me today. So I'm going to talk to you about what frailty is and teach you how we can measure frailty. So I'll be introducing a few tools to you. And particularly, I'm going to focus on one tool, which is the clinical frailty scale. And I'm going to teach you how to measure frailty using this tool through some clinical scenarios. So there will be some voting involved. So I hope that most of you have your mobile phones with you. So what is frailty? Frailty is a syndrome. It's a result of accumulation of deficits over time. And this then leads to lack of physical and functional reserves in that person. So when our reserves are less, we become more vulnerable to stresses. And so when a stressor occurs, we have less ability to compensate when that stressor occurs. And so this would obviously lead to adverse health outcomes, which means poor quality of life and a short lifespan. So I've included a picture of a rope here to try to illustrate this concept. So if you can imagine when this rope was, full, it could probably withstand a 20 kilogram weight. And through time, whether it's through wear and tear and whatnot, strands get cut. And its ability to hold up a 20 kilogram weight decreases. Okay? And eventually it would snap. So that essentially is what frailty is. It's an accumulation of all those deficits and wear and tear, which then affect our ability to withstand a stressor or a weight. I also do need to tell you what frailty is not. So frailty is not multimorbidity, even though we're under the session of comorbidities, and frailty is not disability. They're entirely different concepts, but there's overlap, and these concepts are all related to each other. So as infectious disease physicians, we probably have a lot of things to do in clinic already. So we need to ask ourselves, why should we measure frailty, as though we don't have enough to do? So frailty is an independent risk factor for developing new chronic conditions, falls, cognitive decline, polypharmacy, hospitalization, loss of independence, and increased mortality. And all of these are the fourth 90 that we're striving to achieve in our patients. And we can all agree that these lead to poor outcomes. The unfortunate thing is that frailty is more prevalent in people living with HIV, and furthermore, it occurs to them at a younger age. So you would read most of the papers for people living with HIV, and when you look at frailty, a lot of times our cutoff is 50. Whereas in geriatric journals, they're all about 60 or 65. The great thing is that frailty is transitional and dynamic. So it's not one direction. So it's not just a downward bad direction. It's transitional and dynamic. That means it can change. And I'm going to illustrate that later on through the clinical scenarios. And the great thing is, if we screen for frailty, we're able to intervene early and we're able to disrupt that and reduce the risk of progression of frailty. So this is why we need to measure frailty. So how do we measure frailty? There are 4 tools that I'll just be highlighting to you, and I'll really only be focusing on the 4th one for the clinical scenarios. So the first one we have is the frailty phenotype. The second one is the frailty index. The third one is the frail scale. And the 4th one is the clinical frailty scale. I think we can all agree they all sound the same. And so when I used to read about frailty and I tried to prepare about frailty, basically all the tools all mixed into one. But there are actually 4 different tools, okay? And in a HIV cohort, number 1, number 2, and number 4 have been the most used to measure frailty. All right? So they're all different tools, even though they sound the same. So the first one I'm going to highlight is the Frailty phenotype. And this was actually developed by Linda Fried back in 2001, so it's over 20 years old. And it measures things like sarcopenia, endurance, physical activity, slowness, and weakness. And if you have 3 or more of these, you are considered frail. And these are the parameters that are used to measure this. So I think if you had to do this in clinic, you'd probably panic. Furthermore, you would need to do a lengthy questionnaire, and you would need other tools in order to measure walk time and grip strength, which may not always be available to all of us. So that's the Frailty phenotype. The next one, we have a Frailty index. And the Frailty index was created by Kenneth Rockwood, also back in early 2000s. And this is actually a calculation. You calculate the number of deficits the patient has over the number of deficits considered. And the original one actually has 70 deficits. So you can imagine sitting with your patient, going through a list of 70 things, trying to find out how many deficits they have, and then calculating what the Frailty index is. So this is more commonly used in research. And you can actually create your own Frailty index. If you look online, there are actually 10 steps to creating your own Frailty index, but you still need a minimum of 30 items. That's still quite a long list. So this is an example of some of the parameters that are used in a Frailty index from Guraldi et al. In people living with HIV. These are not the 30, there's more than that. So that's the Frailty index. So I think quite difficult to use in clinic as well. And then we have the Frail scale. So this looks a bit more manageable. So Frail uses, F-R-A-I-L. So F stands for fatigue, R, resistance, A, ambulation, I, illness, and L is loss of weight. So you actually just need to remember 5 questions in order to assess for frailty using the Frail scale. But I'm quite lazy to memorize 5 questions. So I've picked the next one, which is the Clinical Frailty Scale. So the Clinical Frailty Scale is a scale looking at how a person moved, functioned, thought, and felt about their health in the last 2 weeks. And all it needs is us as physicians as the tool to measure frailty. So for the Clinical Frailty Scale, it ranges from 1 to 9, and it's actually created by the same person that did the Frailty Index, which is Kenneth Rockwood. And if you score between 1 to 3, which is very fit to managing well, it means that your symptoms do not limit your activity. If you score between 4 to 7, that means your symptoms are starting to limit your activity, so your activities of daily living. And if you score from 8 to 9, it's typically for people towards the end of life. So today, when I'll be teaching you how to use this tool, I'll be focusing on CFS 1 to 7, okay? Because I think this is the most relevant to us. I think just a disclaimer, if you're thinking, oh, if I look at the pictures, I'll be able to tell the frailty of my patient. So if they have a walking stick, there would be 4. If they have a Zimmer frame, there'll be 5. Actually, the picture doesn't do anything for you. So I don't know why they included the picture, but the picture does not equate to the score. You actually have to read the descriptions of it, okay? So this is the tool we will be using. So for those of you who want to see the Clinical Frailty Scale on your phone, feel free to scan this QR code, but I'll also be showing the Clinical Frailty Scale through my slides. So I'll just give you a couple of seconds to scan this if you'd like. Or you could actually Google Clinical Frailty Scale. Okay. All right. So I'm going to move on to case scenarios to teach us how to measure frailty using the Clinical Frailty Scale. So as this is going to require voting, I'm going to request for all of you to give a try to this question. How confident do you feel about assessing for frailty in people living with HIV? Please scan the QR code. And do you feel A, I can do it, I can measure frailty? B, maybe I can do it, so there's some potential there. Or C, no thank you, this is not for me, I don't really care about frailty. So I'll give you guys some time to scan the QR code. Hopefully everyone is able to. Anyone not able to scan this QR code? Okay, so I'm going to start the voting to give you guys some time to vote. Are you curious about the answer? Oh, there's a 3. Okay, so some people not so interested in how to measure frailty, but hopefully that will change towards the end. I am a person who likes the number 3, so you'll notice that all the options are A, B, and C. Okay, so most of you potentially want to learn about how to measure frailty. And some of you believe you can do it already, which is great. So what I'll be doing is I'll be playing a case scenario for you. And when you're listening to this case scenario, I want you to think about what the frailty score might be. Okay?
Hi, Mr. Andrew Tan. Good morning.
Good morning.
How are you?
Okay,
Okay. And from the last time we met you till now, how have you been?
fine.
Good to know. Shall we just move on and check your viral load? So your last viral load has been well suppressed, and you're taking your medications well?
Yes, I am.
Okay.
So I think we can all agree our consultations are exactly like this. Okay? Okay, majority. All right? So based on that scenario, I'd like you to think, what do you think the frailty score is based on this consultation? A, this person is very fit. 2, this person is fit. Or C, you have no idea. Okay, you can scan the QR code to start voting. Okay. If anyone needs more time to scan the QR code, please just put up your hands. All right, now I'll start the timer for voting. Started the wrong timer. Okay, so most of you have said that he is fit, and some of you have said that you have no idea, and the 3 of you say he is very fit. Okay, and I'll just show you the answer. The answer is actually no idea. So from our routine consultations of, hi, how are you? We're not actually able to measure the frailty for this person. Okay? And I'll explain a little bit more later why it's no idea and not very fit or fit. So this is the next video, and I'm just going to play it. Again, listen to the scenario and think about what the frailty score is.
Hi, Mr. Andrew Tan. Good morning.
Good morning.
How are you?
Oh, okay.
Good. For the last 6 months, we last saw you in last August. How have you been?
Fine.
Okay, good. So can I just ask you a little more? Do you exercise?
Oh, yes. Yes, I do.
Ah, great. Can you tell me a little more? What do you exercise?
Usually it's walks
Okay.
around the park.
Mhm.
And if I've got a bit more energy, then I'll do a bit of running, intermittent, and then swimming in the condo swimming pool.
Oh, wow. That's nice.
Okay, so we've got a bit more information now.
Hi.
Sorry. So again, based on this consultation, what is the frailty score? Do you think he's very fit, or managing well? Okay, just scan the QR code. Everyone good? Then I'll start the voting process again. Okay. Okay, so most of you have said that he is fit. 6 people have said he's very fit, and 10 people have said that he's managing well. So actually the answers are quite varied between the 3. So I'm just going to explain a little bit about what the answer is. And the answer is actually that he is very fit. Okay? Anyone surprised by this? Maybe? So one of the first steps, and I'm going to convince you how to ask about frailty in 3 steps. The first step is just to ask about regular exercise. What exercise do you do and how frequent do you exercise? So just by asking about exercise, we're going to be able to decide whether the patient is very fit, or managing well. So if this is someone who exercises regularly, every day, consistently, they are very fit. If they are someone who only exercises occasionally, then they're fit. But if they never exercise beyond routine walking, which is me, they'd be managing well. Okay? So just by asking whether someone exercises, you're going to be able to determine whether someone is very fit, or managing well. Okay? So that's the first step to deciding about frailty. And as he exercises regularly, he is very fit. Any questions about this so far? Yes?
It said for fit, it says no active disease symptoms.
Mm-hmm.
I was thinking like you already established he's HIV positive.
Yeah.
So I thought like, okay, he has a disease, so to say.
Mm-hmm.
But he is not symptomatic. So how do you account for that then in the very fit?
So he is very fit because he has no active disease and he exercises regularly. Yeah. Oh.
So it also kind of depends how people define exercise as well, no?
Mm-hmm.
So if you ask someone if, say you were to ask my mum, if she exercised, she'd probably say yes, because, she might go for a swim, she might walk. But if you ask her in more detail about whether she does that independently or not, then the answer would probably be no, because she doesn't do it independently. So it suggests that someone that thinks they exercise, and unless you ask them specifically whether they do it independently or not, would be categorized as very fit. And I'm pretty sure my mum's not very fit.
Oh, okay. I agree with you. So independence is actually another question that comes later. Yeah. Okay. So, but the first step to asking about frailty is exercise. So obviously you have to ask about what type of exercises you do. If I asked my mother-in-law what type of exercises she does, she says she cleans the house and she sweats. So that's her exercise. So obviously we need to probe a little bit more about what that exercise really is. Okay. So this is the continuation of that consultation. All right.
Hey, Mr. Andrew Tan, good morning.
Good morning.
How are you?
Oh, okay.
Good. For the last 6 months, we last saw you in last August. How have you been?
Fine.
Okay, good. So can I just ask you a little more? Do you exercise?
Oh, yes. Yes, I do.
Ah, great. Can you tell me a little more? What do you exercise?
Usually it's walks
Okay.
around the park.
Mm-hmm.
And if I've got a bit more energy, then I'll do a bit of running, intermittent, and then swimming in the condo swimming pool.
Oh, wow. That's nice. And you're still swimming and jogging up to maybe yesterday?
No. Actually, I stopped about 3 weeks ago.
You need to tell me a bit more? Why did you stop?
I didn't feel like I had the energy, to continue. I was getting tired very easily.
Okay. It was just tired. You had no particular, for example, chest pain, dizziness.
Oh yeah. Before that, I was feeling a bit dizzy.
Mm-hmm.
And I think it was about that time I slipped. I had a fall.
Oh dear. Okay.
But I think the bathroom floor was wet. So yeah.
Okay. So 3 weeks ago, you slipped and fell in the bathroom. And since then, you have not really gotten back to your regular jogging and swimming.
Yeah.
Okay.
I don't feel quite as stable.
I see. Okay.
But I try to walk.
Okay, so a bit longer. of a consultation. So again, based on that scenario, what do you think the frailty score is? Is he 2, fit, 3, managing well, or has he progressed to a 4, which is very mild frailty? Give you some time to scan the QR code. And then I'll start the voting. Okay, so most of you, there are some people that have answered D. Okay, so most of you had said that he has progressed to very mild frailty, which is a 4. Some of you still say that he's managing well, and there's 2 that has mentioned that he's fit. So the answer is actually he has progressed to a 4, which is very mild frailty. So let's look at why we classify him as a 4. So the next step to ask after asking whether someone regularly exercises is to ask whether they're still exercising in the last 2 weeks. And if they've stopped exercising, you should probe a little bit more as to what has stopped them exercising. You know, it's different from someone going on a holiday. So for example, for him, he had a dizziness and he had a fall. And so that has stopped him from exercising in the last 2 weeks. And you would want to ask, do you still go outdoors? And do you require any help if you are still going outdoors? Why do you need to ask that question? Is because for a score of 4, it says, previously vulnerable, this category marks early transition from complete independence to, while not dependent on others for daily help, symptoms limit activities. A common complaint is being slowed up or tired during the day. So from that snippet of the video, he mentions that he still does walk and things like that, but he does feel slowed up, okay? So he's scoring a 4, of very mild frailty. For someone to score mild frailty, they need help with high-order instrumental activities of daily living. So they start to require help with finances, transportation, and heavy housework. And it sometimes impairs shopping and walking outside alone. All right, so this is why we ask whether they still go outdoors and whether they require any help when they're going outdoors. So this comes, Jeremy, to the point you're making about independence. We're going to try to find out whether they're actually very mild frailty or mild frailty. Okay? All right, so after asking about exercising, you're going to ask them whether they go outdoors. So if they still go outdoors, but they feel slowed and they don't require any help to go outdoors, then they are a 4 of very mild frailty. He's not a 3 or a 2 because he doesn't exercise anymore in the last 2 weeks. So he's very mild frailty. Okay? Any questions about this part? No? Then we'll move on. So there's 2 questions now, right? Do you exercise and do you still go outdoors? So this is actually the last scenario. And again, let's watch this and decide on the frailty score.
From the last 4 that you had till now, have you noticed anything else that has changed along the way?
No, not really. But today I had to ask my friend to drive me here because I wasn't quite sure about my ability, because after the fall I don't seem to be able to coordinate quite that well.
Okay. So now driving, you're already needing someone to be with you.
I feel it's safer. Yeah,
Okay.
because the thing is that sometimes I get worried when I want to press on the brakes and the leg doesn't respond.
Okay, all right. I'll definitely come back to this, basically to reassess the safety of you driving. But apart from driving, if you want to go out to get some things and all that, are you still getting your friend to bring you along?
Yeah, it's easier that way. It's kind of like, I have company and he helps me with the groceries, as well. Yeah. So whenever they are free, I'll get someone to accompany me.
Okay, and this help has only come about in the last week or so.
I've only asked for help about
Just recently.
Just recently.
Okay, so Mr. Andrew, just for me to understand, 3 weeks ago, everything was good. You used to exercise regularly. 3 weeks ago, you had a slip, you fell, and then you feel a bit unsteady. So you are no longer doing your regular exercises, no longer doing much of the activities outside the house. But when you have to, in the last 1 week, you're already needing some help. Like today, your friend brought you here.
Yes.
I see. But in terms of managing your own personal care, like shower, dressing, at home, everything is on your own?
Oh yes, everything is fine then.
Okay, good. So you don't need much help in the house. It's mainly outside.
Yes, because I try to stay in as much as possible. Because every time I go out, I have to disturb somebody to accompany me. So I don't need to disturb them so much.
I see. Okay, so we have got to investigate how you fell, why you fell, and also come back to your medication list.
Okay. So, what is the frailty score? Is he 4, very mild frailty, 5, mild frailty, or 6, moderate frailty? You take some time to vote. Has everyone managed to scan the QR code? Okay, so most people have answered that he's of mild frailty. Some have said moderate frailty, and some has also said very mild frailty. So I'll proceed to the next slide. The answer is mild frailty. Okay, so I'll just explain why it's not a 4 and why it's not a 6. So that next step, if someone, after asking about whether they still go outside and whether they need help going outside, you want to ask whether they require any help with indoor activities as well. So you want to ask whether they need help with things like their personal care, like bathing and getting dressed. The reason why you need to ask that question is because if they have moderate frailty, they need help with all outside activities and with things at home as well, which includes things like assistance with bathing, as well as occasionally getting dressed. Okay? So if they require help with all outside activities and some indoor activities, then they would be someone of moderate frailty. Okay? So the third question, after asking about exercise and whether they go outdoors, if they're mostly indoors, do they require help at home? So if they only require help when they go outdoors and never require help at home, then they are mildly frail. If they sometimes require help at home, they are moderately frail. And if they basically require help for everything at home, then they are someone with severe frailty. Okay, so by asking these 3 questions, whether they exercise, whether they still go outdoors, and what type of help they require indoors and outdoors, we are able to figure out whether they are of a clinical frailty scale of 1 to 7. So he's a 5 of mild frailty because he doesn't require any help at home, but he does require some help, for example, transportation when going out. Okay? So as you can see at the start of my presentation, I mentioned that frailty is transitional, right? So frailty can change. So he can be okay for 1 minute with a frailty scale of 1, and suddenly after a fall, his frailty score has progressed to a 4 and even a 5. But again, what we ask determines what we get, right? So we just ask, hi, how are you? We don't know how frail they are. Ask one more question about exercise, you get a bit more information. Ask about outdoor activities and help, you get a whole lot more of information, Okay? And this is what we're trained to do. We're trained to ask about these questions in our history. And it also helps us get to know the person and the context that they're in. But what's next after screening? We've identified that he has had a fall, so we can potentially refer him to physiotherapy to help him gain confidence, and also occupational therapy for a driving assessment, because these things will help him gain his confidence and maybe go out independently once again. And if we are able to get him to that aspect, then we've reduced him on the clinical frailty scale. That's my time's up. But what resources are available? We have exercise videos and assessing things like nutrition. So how confident? Can we do this? Or do we have to? Yeah. How confident do we feel? Hopefully it's not a C. Okay, so most of you can do it by now. If you can't, then, maybe you can watch this video again and, slowly work on this. Thank you very much. These are my acknowledgements to my Golden Globe actors, Dr. Kajal, a geriatrician, and Mr. Andrew Tan, a community member and the president of class. He's also now on the steering committee for the International Coalition of Older Persons with HIV. Thank you very much.